Assalamu alaikum warahmatullahi wabarakatuh. Today I'll be talking a condition called PCOS, Polycystic Ovary Syndrome, the common symptoms, its causes, and lifestyle management. If you have heard of this condition before, or you know somebody that have talked of this condition, follow me for more. Polycystic Ovary Syndrome is a common condition that affects your hormones. It causes irregular menstrual period, excess hair growth. It causes acne and infertility. Treatment for PCOS depends on if you wish to become pregnant. People with PCOS may have higher risks for certain health conditions like diabetes and high blood pressure. What is polycystic ovarian syndrome? It is a hormonal imbalance that occurs when your ovaries, the organ that produces and releases egg, create excess hormone. If you have PCOS, your ovaries produce unusually high levels of hormones called androgen. Androgen is a male hormone. Female too produce it, but in a minute quantity. This causes your reproductive hormones to become imbalanced. As a result, people with PCOS often have irregular menstrual cycle. They have missed period. They have polycystic ovary, small follicle cyst, fluid-filled sac with immature egg, and they have irregular menstrual cycle, missed period, and unpredictable ovulation. If you know of somebody that have one, two, or three of the symptoms I mentioned, call them so that they can join this video. The ovarian cysts aren't dangerous or painful. PCOS is the most common causes of female infertility. It can also increase your risk of other health conditions. Your healthcare provider can treat PCOS based on your symptoms and also if you wish to become pregnant. There are some ages that affect PCOS. Then what age does PCOS start? Female can get PCOS anytime after puberty. Most people are diagnosed in their 20s or 30s when they are trying to get pregnant. You may have a higher chance of getting PCOS if you have obesity or if other people in your biological family have PCOS, that is genetics. We'll be talking about how common is this condition that I've been talking about. PCOS is very common. Up to 15% of females of reproductive age have PCOS. The symptoms and causes that we'll talk about today is 1. Irregular periods, which is abnormal menstruation involving missing period or not having a period at all. It may also involve heavy bleeding during periods. The second one is abnormal hair growth. You may grow excess facial hair or experience heavy hair growth on your arms, your chest, and your abdomen. And this affects up to 70% of people with PCOS. Also, another symptoms is abnormal hair growth, then acne. PCOS can cause acne, especially on your back, chest, and face. This acne may continue past your teenage years because you know that some of the teenagers do have acne and it may be difficult to treat. Another symptoms is obesity. Obesity, between 40% and 80% of people with PCOS have obesity and have trouble maintaining a weight that is healthy for their age. Another symptoms is darkening of the skin. You may get patches of dark skin, especially in the fold of your neck, armpit, groin, which is between the legs and under your breast. Cysts. Many people with PCOS have ovaries that appear larger or with many follicles on ultrasound, which is egg sac cyst. Another one is skin tags, and they are little flaps of extra skin. They are often found in your armpits or on your neck. Your hair becomes thinning on their health or start to bad. Then another one is infertility. PCOS is the most common cause of female infertility. Not ovulating regularly or frequently can result in not being able to conceive. Some people do ask, can I have PCOS but not have any of the symptoms? Yes, it is possible to have PCOS and not having any symptoms. Many people don't even realize that they have this condition until they have trouble getting pregnant or are gaining weight for unknown reasons. It's also possible to have mild PCOS where the symptoms aren't severe enough for you to notice. Hope you are enjoying the video. If you like, comment and leave a comment behind and share as much as possible. What is the main cause of PCOS? The exact cause of PCOS is unknown. There is evidence that genetics play a role. Several other factors, most importantly obesity, also play a role in causing PCOS. 1. Higher level of male hormones called androgen. High androgen levels prevent your ovaries from releasing eggs, which causes irregular menstrual cycle. Irregular ovulation can also cause small fluid sac to develop on your ovaries. High androgen also causes acne and excess hair growth in females. The second cause is insulin resistance. An increase in insulin level causes your ovary to make insulin resistance. An increase in the level of insulin causes your ovary to make and release male hormone, which is androgen. An increased male hormone suppresses ovulation and contributes to other symptoms of PCOS. This insulin helps your body to process glucose, sugar, and use it for energy. Insulin resistance means that your body doesn't produce insulin correctly, leading to high glucose level in your blood. It is not all individuals with insulin resistance have elevated glucose or diabetes, but insulin resistance can lead to diabetes. Having overweight or obesity can also contribute to insulin resistance. An elevated insulin level, even if your blood glucose is normal, can indicate insulin resistance. The third one is low-grade inflammation. People with PCOS tend to have chronic low-grade inflammation. Your healthcare provider can perform blood tests and measure the level of C-reactive protein, CRP, and white blood cells, which can indicate the level of inflammation in your body. Another question that people do ask is, can PCOS cause a miscarriage? Having PCOS may increase your risk for certain complications, especially in pregnancy. Although most people with PCOS are able to successfully carry a pregnancy, other complications of PCOS related to pregnancy include risk, increased risk of gestational diabetes, preeclampsia, and high blood pressure. Also, preterm birth before 37 weeks of pregnancy, or cesarean section delivery due to obesity, diabetes, or high blood pressure. What are the diagnoses and tests that can be done for an individual with PCOS to know that an individual is having PCOS? In most cases, the healthcare provider can diagnose PCOS after an examination and discussing your symptoms. They may order blood tests or perform an ultrasound to help with the diagnosis. Your healthcare provider will talk to you about your symptoms and medical history. They will ask you about your biological family medical history, will take your weight and blood pressure, perform a physical examination looking specifically for excess facial hair, because I talk about it in the symptoms: hair loss, acne, discolored skin, and skin tags. They will perform a pelvic exam to look for other causes of abnormal bleeding, and other blood tests also to check hormone level and glucose level, and pelvic ultrasound to look at your ovaries to check the thickness of the uterine lining and look for other causes of abnormal bleeding. What are the three symptoms to diagnose PCOS? Typically, a healthcare provider will diagnose PCOS if you have at least two of the three symptoms. 1. Irregular or missed periods. Some people with PCOS have very heavy bleeding when they do not have a period. 2. Signs of excess androgen, such as acne or excessive hair growth or a blood test confirming high androgen level. Enlarged ovaries or polycystic appearance of ovaries on ultrasound. Many people don't develop cysts. Then there are management and treatment for PCOS. The healthcare provider will determine treatment based on your symptoms, your medical history, and other health condition. And if you want to get pregnant, treatment can include medication, lifestyle changes, or a combination of both. If you don't plan to become pregnant, treatment include hormonal birth control, insulin sensitizing medicine, medication to block androgen. Some medication can block the effects of androgen. Lifestyle changes, eating a nutritious diet and maintaining a body weight that is healthy for you can have a positive effect on insulin level. If you want to become pregnant now or in future, treatments for PCOS include drugs to induce ovulation like clomiphene and gonadotropin are given by injection. Clomiphene is taken orally. Surgery, a surgical procedure can help restore ovulation. There are some natural and lifestyle management that you can do for individual to be taking balanced diet that is low in sugar and high in fiber, gentle exercises like walking and yoga, weight management, stress reduction, and adequate sleep. Islam teaches us patience and hope. Illness is not a punishment. You should know that Polycystic Ovary Syndrome is a medical condition. It is an hormonal imbalance that is affecting the ovaries. It is common in young women, and PCOS is manageable. It is not a life sentence. Thank you for watching, and always follow for more health tips, and always follow your doctor's advice. Thank you.